All right, a Fox News alert for you. Tom Price expected to be sworn in as the next Health and Human Services Secretary in just a few hours. The Senate confirming him to the position as early as this morning. It comes as lawmakers continue their battle over the Affordable Care Act. Republicans hoping the new secretary will help undo parts of Obamacare. Meanwhile, Democrats slamming Price's confirmation.
Make no mistake, in the dark hours of the early morning, with the confirmation of Secretary Price, the Republicans launch the first assault in their war on seniors.
Ooh, harsh words. Joining me now is Dr. Mark Siegel from the Fox News Medical A-Team. He is also a professor of medicine at NYU Langone Medical Center. This is the most important guy. Good morning to you. The most important guy and probably the most important battle, depending on how you look at it. The critics say that Republicans have been talking about replacing Obamacare all this time. Why don't they have a plan ready? Does he have a plan ready?
Well, he actually had a plan in 2015 called Empowering Patients First Act that he tried to get through Congress. Of course, it didn't get approved because of President Obama. So
is it ready now?
So he already has a plan. Well, he's also agreed with Paul Ryan's plan. So the two of them together really have put minds together. Before I get to that, because I want to talk about the details of that, but I want to tell you this is a historic appointment. This is only the third time in the history of HHS, 63 years, that we've had a physician. The second time was Dr. Louis Sullivan under President George Bush, 41. Now, he was a health reformer. So physicians everywhere are excited about this. The American Medical Association, which is a huge supporter of the Affordable Care Act, also wanted him. They also recommended Dr. Price. Why? Because they think he's for physicians, that he's for the doctor-patient relationship where you actually sit there with your patient and make decisions. Remember that? Also, medical malpractice reform, which the AMA is hugely for. So for the AMA to be supporting him as well as his, the idea that he's against the ACA
is a big deal and is a big sign of endorsement. Let me ask you, because I know that you guys are getting ready to do a sit-down interview, and this is the guy who's at the head of reforming Obamacare. What's the first question you have for him?
Well, the first question I have for him is, how quickly could you get into place some of the ideas that you have, that Dr. Price has, for privatizing things? Like
what? What do you think are his two best ideas that he should jump on?
He wants health savings accounts.
Yeah.
Okay. He wants tax credits to buy insurance. He wants to move us back to a time, and this is going to be controversial, to a time when older people actually pay a little bit more for their premiums.
No one's going to like that, except for younger people, I guess.
Well, but younger people will like that, because younger people are saying, well, wait a minute, why are my premiums so high? But he does want to keep pre-existing conditions covered. He's going to go to high-risk pools, which you and I have discussed before.
Right.
Those have had higher premiums, but they'll be state-run pools. He wants Medicaid to be under state jurisdiction, where block grants go to the states. And another thing from a business point of view, Melissa, is to give the idea that Medicare, you could have a private option. If you want to, you could use your money from Medicare to buy a private option. All about more choice, more tax credits, transparency of prices, privatizing the system, and getting the government out of it.
So one great idea that you had the last time we talked about this idea that everybody wants to keep people with pre-existing conditions, let them have their insurance and not have them be denied. That's expensive. You had the idea of they need to be pooled in larger pools, maybe across the country, but this is where the government's money should be directed, towards subsidizing these people who use a lot of health care and who cost the system a lot, but need the insurance. Does he support that idea? Do you know?
He not only supports that, he really initiated that.
Oh, you stole it from him. You didn't tell me that.
I stole it from him because his idea is that subsidies should be in the high-risk pools.
Yeah.
He's fully aware, Dr. Price, that the premiums will be higher in those pools. But remember, right now we have a system where if I go to a state website and I pay $350 for a premium, I'm reimbursed $250 on average from the government. He wants the government to be spending less money for the worried well and more money for the actual sick.
That makes sense.
And again, I got to emphasize, a physician dealing with doctor-patient issues. Hooray for that.
Makes a lot of sense. Thank you so much for always staying on top of this, Bill.
Thank you.